Hi, good afternoon, everybody. Thank you for joining us today. My name is Ashley Jackson. I'm the Director of Membership Marketing with the Florida Restaurant and Lodging Association. Before we get started and I introduce you to our speakers today, I just want to go over a few housekeeping items. I want to remind everybody that this webinar is being recorded and will be shared after the webinar this afternoon. I will send an email to all registered attendees and it'll be posted on our webinar page and the FRLA YouTube page. So please feel free to share that. I also want to encourage you to ask questions throughout the webinar. And we will get to those at the end of our presentation. So thank you for joining us. And with that, I want to introduce to you our good friend and partner, Mariah Murphy with United Health Group.
Hi, everyone. Good afternoon, and thank you so much for joining us today. My name is Mariah Murphy. I'm the Director of Association Partnerships with United Health Group. And we are a proud partner with the Florida Restaurant and Lodging Association, as well as the National Restaurant Association, and about 70 other state and regional restaurant and lodging associations across the country. Our goal is to provide better access and more affordable options for healthcare solutions for the hospitality industry. And we've got several programs in which we're doing that. But what we're going to talk about today is a really exciting program that works for every employee that you may have, and a great option for recruiting and retaining employees, a very affordable way to provide healthcare options when and where they need it. So without further ado, I am going to introduce our speaker today, Nick Gates. He is the manager of broker sales for Teladoc Health, and he's going to talk to you today about serving the needs of the people that serve us. Nick, take it away.
Great. Mariah, thank you so much for such a great introduction. And I'm just so happy to be presenting to our friends at the Florida Restaurant and Lodging Association. So as Mariah had mentioned, my name is Nick Gates. I'm the manager of broker sales at Teladoc. Myself and my director, Andrea Sadler, we manage the partnership between Teladoc Health, the National Restaurant Association, and United Health Group. And our goal is to provide affordable access to healthcare for all employees within the hospitality industry. So a little bit about Teladoc Health as an organization. Our number one core value is that we're passionate about taking care of people. And our mission as an organization is to empower all people everywhere to live their healthiest lives by transforming the healthcare experience. So Teladoc was formed in 2002. We're considered to be the OG in the telemedicine or virtual care space. In 2015, we became the very first publicly traded telemedicine company on the New York Stock Exchange. Our ticker symbol is TDOC. Current valuations right around $22 billion. We have over 4,000 employees across 20 different countries, 40,000 employer clients, of which over 50% of Fortune 500 companies use us for our virtual care services. And we proudly serve 70 million members at this point. So we're truly deserving of the title of global leader in virtual care. So for those of you that may not be aware of what virtual care is, or maybe you've heard terms like telemedicine or telehealth, the best and simplest definition is that we connect people with a wide variety of healthcare providers using technology. So here at Teladoc, there's three main ways that people access our healthcare services. Number one and foremost being our mobile app. We also have an online member portal and a 24/7 call center. We don't want technology to be a barrier for people getting their healthcare. And so as long as you have a landline telephone, a internet connected computer, or a smartphone or tablet, you can get access to high quality healthcare. In addition to that, we don't want language to be a barrier of care. So all of our services are available in English and Spanish. And we partner with Language Line to offer translation services for up to 240 additional languages. But what brings us here today is really talking about why virtual care is important, specifically in the hospitality space. And first and foremost, I want to acknowledge that the staffing shortage that you're experiencing is real. So I think we can all understand that we all had a hope that when unemployment benefits were clawed back, that there'd be this influx of people that wanted to come and work, specifically in the hospitality industry. But that hasn't happened yet. And what's really interesting, and there's been a couple articles that have validated it, but the job shortage and the labor shortage has been widely acknowledged. And specifically, there was a job list article that was written in July, just as a job market report for Q2. And what they acknowledged was that 60% of job seekers actually don't want to go and work in the hospitality space. And there were three main reasons why. The first being that people just didn't like the setting. But reasons 2 and 3 were actually shouldn't be of any real surprise. But there was a perception that the jobs within the hospitality industry are more lower paying than other places or other industries out there. And the last reason for people not wanting to go and work in hospitality was really surrounding benefits and the lack of benefits within the hospitality space. And so what used to be a really large pool of people that you'd be able to pull from to get to attract employees to come and work for you, right now is really just a puddle, and you're competing with a lot of other hospitality employers for talent. In addition to trying to retain the current people that you have and make sure that they're not overworked or burnt out. But when it comes to benefits, and that's really the reason why I'm here today, historically, hospitality employers just haven't offered any type of benefits outside of, the pay to the employees. And it's for, some strategic reasons why. So most restaurants and hotels tend to have less than 50 full-time equivalents, and they carry a large percentage of variable hour and part-time workers. So even if you did offer health benefits, a lot of these employees wouldn't be able to enroll in your health insurance plan just because of the number of hours that they work. But it doesn't mean that they don't need health insurance, because when they don't have employer-sponsored benefits, they fall into one of two categories. They're either going to be what's called underinsured, meaning that they may have access to health insurance elsewhere, but to be able to use those benefits is unaffordable when you think of the out-of-pocket cost of healthcare. It's $100 to go to the doctor's office. It's $1,000 to go to the emergency room. Employees people just have to make decisions of whether or not to actually get care, and the cost is the #1 barrier for them to do that. Or they may not have insurance at all, and they're completely uninsured, and those people don't get care either. And both are dangerous scenarios for you as a hospitality employer, because they're serving people, and if they come to work sick, then they can infect people. And obviously with going into a post-COVID environment, that's a big no-no. But in addition to the healthcare needs that your employees have, we also need to address some of the mental health care needs that they have as well. There was an epidemic of mental health issues in the restaurant and hotel industries prior to COVID, but they've really been exacerbated when people were laid off. They didn't have incomes, and so we saw kind of the rate of suicides go up during COVID, and a lot of that was inside the hospitality industry. But prior to COVID, 17% of employees in the hospitality industry were diagnosed with substance abuse disorder. If we double click on the restaurant industry in particular, 1 in 5, 20% of restaurant employees struggle with drug or alcohol addiction. And so there's an immediate need and a pressing need to address the mental health care needs of your employees as well. And that's where virtual care can really step in and assist with that. So when we partnered with the National Restaurant Association, we wanted to make sure that we address all of the healthcare needs and mental health care needs of your employees. And so we developed the HealthiestYou Complete bundle. Now, we know as hospitality employers, it's really important that whatever benefit program that you try to implement is comprehensive, but it's also easy to explain and easy to administer. And so with the HealthiestYou Complete bundle, we offer a wide variety of healthcare services that you can see on the right-hand side, where everything is free and unlimited for the employee to use. So our general medical, mental health care, dermatology, neck and back care, expert medical services, and nutrition, all of those services are free and unlimited to use, not only for the employee, but we extend the benefit to spouses and kids. And so we've created a really attractive price point with our negotiation with the National Restaurant Association and United Health Group to offer this at $9 per employee per month. Now, I understand that the minimum wage in Florida is going up to $10 at the end of the month. And of course, if you have tipped employees, it's $6.98. But for around the cost of 1 hour per month of minimum wage, you can offer free and unlimited health care to your employees. And we understand too that as an employer, you wear a lot of hats, especially just across the board. So we wanted to make sure that we take the burden of marketing and education and awareness of the benefit off of your plate and off of your shoulders. And so we have a dedicated client success team that will help develop a marketing plan with you to roll out the benefit, offer paper marketing materials, swag items. We'll host webinars and education events to make sure that your employees are aware of the benefit that we're offering, and that's at no cost to you as the employer. We know that once the employees understand and are aware of the benefits that they have, they'll use those services as well. Now, I understand that obviously showing a slide isn't the most appropriate way to showcase a benefit, so I'm actually going to do a live app demo here in just a moment, but just understand that these are all the services that we're going to go through here in just a few minutes. We often get asked, what are the common things that we can treat virtually over the phone? And here's a list of the top 50 diagnoses that we treat on a regular basis. You'll see very common things like cold, flu, pink eye, but there's also some uncommon items that people didn't realize that our physicians can treat over the phone, like urinary tract infections or sprains or strains. This list accounts for about 70% of the reasons why people step foot into a doctor's office, and we can handle those virtually over the phone at no cost for your employees and their family members. So to basically showcase the Healthiest You mobile app, I'm actually going to hop over here in just a moment to showcase all of the services. So Mariah, if I could get a verbal yes or a thumbs up.
Yes.
That you can see, fantastic.
We've got it, yeah, thank you.
Awesome. So when a member logs into the Healthiest You app, this is what they're going to see. It starts with my dashboard. And so you can see that I have an upcoming mental health visit. We'll talk about that here in just a moment. And all of the services are going to be found right here in this Request a Visit Now function. And I'm just going to go through, like I'm a member, we'll talk a little bit more in depth about each of the included services and how the members will access them through the app. So I touched on the fact that all of their, that employees and their spouses and kids would get access to the services. So here's 3/4 of my family. My spouse, because she's over the age of 18, she has her own profile, but she can use all the services in the Healthiest You bundle as well. I'm going to go ahead and select myself that I'm going to need care today. And I'm going to change this actually to Florida so that everything is in your state that you're seeing. Now, when you select the states, just to make sure that we pair you with providers that are licensed to do business in that state, and you'll see 4 of the 6 services right here in the Request a Visit Now function. So we're going to start with general medical. So this is what Teladoc's been doing for the last 19 years. It's providing 24/7, 365 access to speak to a physician via phone or video. We have over 12,000 physicians in our general medical network, and they have an average tenure of 20 years. And we let our members have either an on-demand visit with a physician, or they can schedule a visit up to 48 hours in advance. So we know that a lot of hospitality employees, they may want to schedule a callback on their break. Otherwise, if you have the ability to do an on-demand visit, we can do that now. We did 10.6 million consultations in 2020, and our average callback time was 9.8 minutes. To put that into perspective, if you try to go to any physician in person, you're going to spend at least 121 minutes of time. And so we can handle the same diagnoses and the same treatment and offer the same treatment plans in under 10 minutes, and obviously from the comfort of your own home. So I'm going to go ahead and hit next, and we'll continue with the flow. Now, we obviously selected a phone visit for our visit, so we want to make sure the member has the opportunity to update their phone number, so they can do that right here. And then our physicians actually call from a blocked phone number. And it's important because we don't want the cell phone numbers of our physicians to be out in the market for people to just call at random. So we'll actually do a blocked phone number, and we'll send an email or text notification to the member ahead of the call, and they have the opportunity to opt into those. Then we're just going to have them tell us what's the reason for their call. So believe it or not, COVID-19 only accounts for about 10% of our visit volume. In addition to that, though, most people will call us for cold, cough, earaches. Maybe they just need a prescription refill for some of their maintenance medications. And so we offer all of that directly here in the Healthiest You app. So I'm just going to say that I have a cold today. If I had something like a sore throat or maybe pink eye, you can actually upload photos for the doctor to diagnose and to help them diagnose you properly. And anything that you upload into the Healthiest You app is fully HIPAA compliant and secure. We've never had a data breach in our 19-year history. We do have the ability to write prescriptions for our members, and so we're going to have them actually tell us where they want the prescription to be sent to. Mariah, if you could help me with a zip code for Florida, that'd be
sure. Awesome. How about 32301? That's in Tallahassee.
Fantastic. So I'm going to do 32301. And so we just have the member choose the pharmacy that's closest to them or what their preferred pharmacy is. So it looks like CVS, it's right down the street, half a mile. So I'm going to select that CVS location. And this is the receipt screen. So every receipt screen that you'll see in the Healthiest You app is going to say $0 because everything is free and unlimited to use. We just have one more question that we have the member answer, and that's where would you have gone if you didn't have access to virtual care? And we know a lot of hospitality employees, they work odd hours, and so the only options when they get off of work are going to be to go to the emergency room or the urgent care. And part of our value prop here at Teladoc is that we can eliminate or reduce unnecessary use of those two environments. And we actually provide reporting every single month to our employers to showcase how your employees are using all of the services within the bundle in the form of a utilization report. Once the member selects those two checkboxes and confirms their visit, they're going to be in the queue to have a doctor reach out to them. So that is general medical, pretty cut and dry. Now we know that I talked a little bit about mental health care and the reasons why it's so important in hospitality. And we really provide just an excellent mental health care offering right here in the HealthiestYou app. So members actually can have unlimited mental health sessions with a provider from our vast network of providers across the country. Right now, we have over 2,500 therapists in our network of mental health providers and over 576 psychiatrists. Now, it's really important. Virtual care really helps fill in a need in the mental health care space because 55% of counties don't have access to a psychiatrist, and 64% of counties have a shortage of mental health providers altogether. So I'm going to show you the list of available providers here in Florida here in just a moment when it pops up. And then I'll show you how you can filter them out. So we want the members to be able to find the right provider for them. And so we have a wide variety of them. So Florida has one of the largest counts of providers that we have in the country. And we want to showcase on this first list of providers, any provider that has availability within the next 7 days. So even though we can't offer an on-demand visit, the time frame that people wait for to have a visit with us here at HealthiestYou and Teladoc is far quicker than what you get in person, because you're going to wait on average 6 to 8 weeks to get in person with a therapist. But you can filter out based on gender, language, or any one of 44 specialties. And if you need medication support or need to talk to a psychiatrist, you're just going to toggle this button right here at the top. So I don't need to talk to a psychiatrist today, but I think I need to talk to a counselor or a therapist. So I'm going to go ahead and choose Lewis. He has appointments as soon as the 18th, which works best for me. So it's on a weekend when I'm not working, and he has an appointment at 2 p.m. The majority of our providers are going to have slot scheduling, which means that you have a guaranteed appointment at that date and time. And our average session for therapy is right around 45 minutes. And we allow our members to do either a phone or a video visit. We know that based on COVID-19, depression and anxiety has been a huge concern. In fact, 40% of Americans have diagnosable symptoms for depression and anxiety as a result of COVID-19. So I'll select that, and then I'm going to hit continue. Now we have the member complete what's called an emotional health questionnaire. And basically with this, it's going to set a clinical baseline for the provider to just know where the member's at emotionally. And I want to bring your attention to question number 11. It's right here at the top, thoughts of actually hurting yourself. If the member selects anything other than none, they're going to be prompted to reach out to a suicide hotline. And if they don't reach out to that hotline within 24 hours, the hotline's going to reach out to the member using the phone number in their profile. And it's just a way for us to provide an immediate resource for that person in crisis. And it's not going to prevent them, though, from scheduling the visit with their mental health provider. So once they finish the actual emotional health questionnaire, you'll hit continue, and then you'll have a guaranteed appointment on that date and time. Now you can continue having continuous sessions with that same provider. They're going to be auto scheduled in the message center and on your dashboard after your first visit. So, and if you're not happy with that provider and you want to switch to somebody else, you can actually switch to a new provider at any time. Not a problem at all. So that is our mental health care service. Now, the next service that I'm going to show you within the bundle is actually our Dermatology Service, which is actually my favorite service in the bundle. So I have a 1-year-old that has really bad eczema. So in a traditional sense, I'd have to go to his pediatrician or a dermatologist to have that treated. But what's really great though is like most skin conditions don't require an in-person consultation. Our high-def cameras are more than able to capture a skin condition for a dermatologist to review, and that's exactly what we have our members do. So every month when I go in here for my child's eczema, I'm going to actually fill out the rash questionnaire. And after I fill out the questionnaire, all I do is snap 3 photos of his back and the scaly patches on his back and his knees. And I submit the case with the photos, and we guarantee that a dermatologist will actually review your case within 48 hours. Every single month that I've used this service, I've gotten a response back from our dermatologist in our message center within 1 hour every single visit. And every time, and all of our employees use our dermatology service, and typically within less than an hour, people are getting responses back. So really powerful service from the dermatological perspective. And I usually get a notification from CVS before I even go into the message center to review the doctor's notes, saying that I have a prescription for a clinical grade hydrocortisone cream waiting at the CVS right up the street from me. So really powerful tool for myself and my family. But I also think about kids that may have like acne or members with rosacea. It's a real burden to have to go into a dermatologist's office because they're typically 6 to 8 week in advance type of appointment that you'd have to make. And so we can offer those and get you a prescription or whatever treatment that you need within that really short amount of time of less than 48 hours. The last service that's right here in the request to visit now functions, our nutrition service. So similar to mental health, we want members to be able to speak to a registered dietitian of their choice. We all know that the food that you put in your body is the best preventative medicine. And so we wanted to make sure that we provide access to dietitians for people to be able to discuss their diet. Maybe they have a medical condition that they have to tailor a specific meal plan to. Maybe they're just focusing on general wellness, but we provide the same tools for them to be able to filter out and based on specialty, gender, who they want to talk to as far as the registered dietitian is concerned. So I'm going to go ahead and select Grace. She's the one here right here at the top. As you can see, you can do a phone or video visit. We'll do a phone call visit with her this time. And you can see you'll have slot scheduling similar to the mental health service. Now we just have the member select a date and time, and then they're going to complete a nutritional assessment. And we have them do that. So they're going to tell us what vitamins they're taking, what supplements they're taking, and provide an overview of their just diet on a daily basis. During the very first session with the dietitian, they're actually going to offer and generate a meal plan for breakfast, lunch, and dinner for the member that's tailored to their medical conditions, their goals, whatever their reason is for coming to them. And they're also going to provide a shopping list. And because they're registered dietitians, everything's going to be clinically based. And so we want to provide all of the resources from the Academy of Nutrition and Dietetics for the member that supports the meal plan that's been prescribed. And the member can have unlimited sessions with their dietitian. We have members that will meet with the dietitian once a week as an accountability measure, or we tend to recommend they meet with them at least once a quarter. But we don't dictate how often they can meet with the dietitian. So that is nutrition. Now the last two services are actually going to be right here on the dashboard, and we'll go through expert medical services first. And expert medical services, so Teladoc, we acquired a company called Best Doctors back in 2017. And Best Doctors was a network of physicians from around the world that are considered to be the top 3 to 5% of physicians in their subspecialty. So we engage with that network of physicians when members come to us needing a second diagnosis on a major, or a second opinion on a major diagnosis. So things like cancer, which are misdiagnosed 28% of the time, it's imperative that people get a second opinion, and obviously getting it from the top expert is always the best option. And so when members come to us with a diagnosis like cancer, we're going to collect all of their medical records on their behalf. We'll retest all pathology, review all of their imaging, and we're going to send a packet of that data to a physician within the Best Doctors network that specializes in that diagnosis. Now, 48% of the time, we're going to be improving the member's diagnosis. 79% of the time, we're going to be improving their treatment plan. And 95% of the time, members will adhere to the treatment plan that we recommend here at Teladoc for their ongoing treatment of whatever their diagnosis is. So really powerful tool. It's probably not going to be the most used service, but it's going to have the most impact for people that have a major diagnosis. The last service within the bundle is called neck and back care. And we partner with a virtual spine care clinic by the name of Telespine. And when a member comes to us with neck and back pain, we're going to pair them with a certified health coach that has a master's degree in an orthopedic field. They work directly underneath a physical therapist. And they're going to create a personalized video-based exercise and stretching plan for the member. And what's great is they have really incredible clinical results. So after a 4 or 8 week program with Telespine, 56% of members indicate they have an increased function in whatever their pain was, and 58% have a reduction in pain. And their goals in organization at Telespine is to keep people off of opioid medications because 80% of opioids are actually prescribed for neck and back pain. Now, speaking of prescriptions, we know a lot of our members may not have access to a prescription discount plan through their, because they don't have health benefits. And so we actually want to offer a prescription discount tool right here in the HealthiestYou app. And it's actually powered by GoodRx. So I'm going to go ahead and use 32301, and then I'm going to search for, common antibiotic, amoxicillin. And what we're going to show you is actually that you can actually see where the lowest cost is for that medication. So for the full prescription regimen, you can see it's only $3.96 at the CVS that we chose. And the members can actually add, you can add the coupon directly to your Apple Wallet or show this to the pharmacy. It has all the information to be able to offer them that discounted prescription pricing. And we always tell our members, even if you have access to health insurance, to use our price prescription tool, because 7 out of 10 times it's going to be less expensive. So that really summarizes all of the services in the HealthiestYou Complete bundle. Again, it's only $9 per employee per month, and they get free and unlimited access to all of the services, not only for themselves, but for their family as well. So I want to go ahead and I'll stop showing the demo, and then I'll go back and start showing to offer this as an opportunity to ask questions. So Mariah, are there any questions that have come through?
So Nick, the only question that we have as of right now was just from the very beginning when you were discussing the labor shortage and the number that 50% of people that were polled were not interested in coming to work or back to work for the hospitality industry. The question was just asking about the reference for that, who conducted that poll, if you have that information.
Yep, so it's a company called Joblist. So it's a popular job search site, and they do a quarterly job market report. And so their Q2 job market report that was published in July outlines the statistics regarding hospitality labor shortage that I referenced.
And as of right now, we do not have any other questions. If anybody has any questions, please post them in the question section. If you don't, you've got Nick's information here. And my information is available through the Florida Restaurant and Lodging Association. You can also reach out to your regional director or the staff at FRLA to get back in touch with us. This information will be posted on YouTube, and we will be sending out information on where to access that. Nick, do you mind, though I wouldn't mind if you have a second, just to touch on, I know we talked about this being a great solution for the employees who currently don't have access to health benefits through the employer, but how about those employers maybe that are a little bit larger, that are perhaps either on a very high deductible health plan or that are on a self-insured plan? Does this fit in, if you could explain just how this fits in with those types of plans as well?
Yeah, so it absolutely is a perfect complement to an existing health plan, especially for those that are self-insured, because by having a separate telemedicine program that has really great utilization, and we always can share our utilization numbers. So our block of business, tends to have about 50 to 60% of people using our general medical service in addition to all of the other services in the bundle. But anytime that we have a consultation on our program versus using the health plan, not only is it free for the member to use with us, which incentivizes them to come and use our virtual platform, but there's no claim that actually hits your claims bucket or that you have to pay for as a self-insured employer. And so we can have a direct impact on your claim spend just by encouraging members to use our virtual platform first. And we have great case studies that we can always share that show how significant of a claim savings that we can offer. But in addition to that, if you have a health plan that maybe has higher copays or has high deductible in general, members are always going to want a less expensive offering. And so having this as kind of their starting point to give them $0 cost for a wide variety of healthcare services, they're going to be more likely to use this than actually use their health plan, which is beneficial for you as an employer.
Thank you so much, Nick. We don't have any other questions at this point, so I think that we can wrap it up. We definitely appreciate everyone coming and participating today, hearing a little bit about this. I think once you sort of, absorb it a little bit this time of year as you're looking at your benefit package and your offerings as you move into towards the end of the year and next plan year. I hope you'll consider this, reach out to Nick or to myself if you have any additional questions or would like to talk a little bit more specific. Again, the pricing that is available through the Florida Restaurant and Lodging Association for this entire package is just absolutely amazing. And you won't find a price like that for this type of a product, any type of a product in this type of a package anywhere. That's part of the member value of being part of the Florida Restaurant and Lodging Association, and we certainly appreciate your membership as well. If there's no further questions, I think we could say goodbye and thank you again, and hope to hear from you all soon.
Thanks, everybody.
Thanks,
Thank you.
everyone.